Hi, I'm Dr. Jennifer Degler, and this is our fourth video in our series on helping your stressed out brain chill out. And I'm talking about what you can do to manage your anxiety. And in the previous video, I talked about nutrition and sleep hygiene. I want to talk to you now about exercise, because exercise can really be huge in the management of anxiety, particularly just looking at it long term. Because if you struggle with anxiety, chances are it's something you've been dealing with really your whole life. And so you have to look at managing it as kind of a chronic condition that you just work on your whole life. And so exercise is key. And when you exercise, you're helping create new neurons that produce that feel-good transmitter called GABA. And also when you exercise, it's just boosting those feel-good chemicals in your brain like serotonin and dopamine and norepinephrine. And it's also helping you with those natural pain relievers that your body can produce, those endorphins and those endocannabinoids. So that can help buffer some of the effects of stress. And when I say exercise, I don't mean you have to join a gym. If you will just take a walk every day, a vigorous walk outside, that is awesome. There's great research to show that being in a green space every day, taking your brain out where there are trees and there are grass every day, can have a really good effect on the anxious brain and help your nervous system make that switch from the sympathetic nervous system, which is the fight versus flight emergency response, to the parasympathetic nervous system, which is the relaxation response. It's not just kids who need to get outside and play. Adults need to do that too. And also there is good research to show in the treatment of depression that vigorous aerobic exercise can be helpful. Now, you may not be dealing with depression, you may be dealing with anxiety, but I have found anxiety that's left untreated after a while can turn into depression. So you may have kind of an anxious depression where really the anxiety came first, and then when that wasn't managed over time, you develop depression as well. And so there's some research to show the vigorous exercise 3 to 5 times a week for about 45 to 60 minutes, vigorous aerobic exercise, can be as effective in the treatment of depression as an antidepressant medication. So that's worth trying. If you are on antidepressant medication and would like to try and get off of it, see what happens when you really become dedicated to some vigorous aerobic exercise done 3 to 5 times a week. Another thing that you can do exercise-wise that can really be helpful for the management of anxiety is yoga. And, yoga is really a series of movements built around breathing. And we tend to think of yoga as, well, I'm getting in all these weird postures, but so much of yoga is about breathing and concentrating on your breathing and controlling your breathing, which has a wonderful effect on the brain. And a lot of times when you're doing yoga, you're so concentrated on the poses, and you don't want to fall over, that you're not thinking about anything else. So that's really good if you've got that anxious, hungry mind that always wants to worry about things. I also want to recommend to you something called embodiment yoga. I know here in Lexington that's available at Radically Rooted Yoga and Lifestyle Center. It may be called something else in your area. It's basically yoga that is going to involve the fascia, working with the fascia, which are your tissues that run throughout your entire body. And of course, your nervous system is encased in your fascia, in your tissues. And those tissues can become kind of frozen and stiff, and that prevents really good flow in your body, and that can make your nervous system just less regulated. And so you can use these fascial practices to help regulate your nervous system. I know I do that every week at Radically Rooted, and it's just so powerful. And it's not like traditional yoga. We do very, very little yoga as part of that. We work a lot with these balls, these therapy balls. This is a therapy plus ball, and these are called alpha balls, and you're actually rolling them on your fascia. and rolling on top of them. And it's kind of like getting a self massage. You feel fabulous when you leave. But also learning just different hacks, if you will, to help hack your nervous system and calm your nervous system down. So I do encourage you, check that out, because that has been personally very helpful to me in learning to regulate my nervous system. Okay, so another thing is anti-anxiety medication. And that would fall into two categories. One would be the medications for anxiety that are going to work immediately. And so typically that's going to be a benzodiazepine. That's going to be something like Xanax or Valium, where you're going to take that and maybe some Klonopin, something that it's very, just immediately you're going to calm down. And they are working. Remember, we talked about this being your brain and this is your midbrain. They're working a lot on that midbrain and calming that down. Now, they are addictive. And so we want to be really careful about taking those, because they do have the potential for you to get addicted to them. But you may really need them, particularly if you are very anxious, to the point where you're having panic attacks several times a week. It is a huge effort to draw your mind away from ruminating worry. If you're really beginning to get kind of paranoid and just, kind of losing touch with reality because of these worried thoughts, if you're sick to your stomach and filled with dread most of the time, and to the point where you can't eat and you can't sleep, that's a very high level of distress. And so you may need those immediate acting anxiolytics to help you, and those would need to be prescribed by a physician. The other category would be antidepressants, which also can help with the long-term management of anxiety. And oftentimes those are the SSRIs. That stands for selective serotonin reuptake inhibitor, which is a big old mouthful. Typically that's going to be something like Prozac, Zoloft, Paxil, Cymbalta, Lexapro, any number of those. Trintellix, they're always inventing, always coming up with new ones. But if you take them, you're not going to feel anything. They're going to take at least 3 weeks to start working. And really, it's going to take 6 weeks for you to see the full effect. So they're not the kind of medications that you're going to be able to sell on the street, because people take them and they don't feel anything immediately. So you have to take them and you're like, why am I taking this? But over time, what it's doing is oftentimes it's helping more serotonin, which is a neurotransmitter that has a calming effect. It's helping more of that neurotransmitter remain in your synapses, in your nerve cells, so that the whole nervous system is just calmed down. And they can really be life-changing. I've had clients that are just oftentimes very averse to being on medication, but then over time, as they are on this, are like, wow, I feel like I'm back to myself again. And oftentimes they're people that have been anxious their whole life, or they've had, just some significant chronic stress in their life, and it's just kind of changed their brain, and their brain needs that little bit of extra help. So you can, again, talk to your physician about being prescribed something like that. The last thing I wanted to do on this particular video is just address, if you are a Christian, and I'm a Christian, many people in my audience are Christians, oftentimes we feel very bad about taking medication. We feel like if I had a strong enough faith, then I shouldn't need some type of psychotropic medication. It's interesting, though, I don't think you would feel that same guilt for taking insulin if your pancreas didn't metabolize sugar properly, or if you had cancer, you would take chemo. But oftentimes, because psychological disorders result in emotional struggling with emotions, we feel like, well, then I shouldn't need medication for that. If I was a good enough Christian, I had strong enough faith, I wouldn't need that. And I just want to encourage you to disregard those beliefs. They can really keep you trapped. And medication can be very, very helpful. And in later videos in this series, I'm going to talk to you about a lot of techniques you can use to use your brain to help change your brain and manage anxiety, so that hopefully either you won't need medication or you could come off of your medication. But for some people, they do need to be on their medication perhaps the rest of their life, and that is okay. And if that helps you live a fuller life and helps your relationships be better and help you just truly to embrace the abundant life that Jesus promises us as believers, then I hope that you will take your medication without any false guilt and feel really good about that. You know, Scripture tells us over and over and over again, don't be afraid. As a matter of fact, don't be afraid is the most common do not command in the Bible. There are so many instances of don't be afraid, fear not, don't worry, don't fret that the Bible talks about. I think because God knew as our creator that the way he created our brains, that they don't work very well. We don't make very good decisions when we are operating out of fear and when we are operating out of worry. And so that's why I hope that you will get treatment for anxiety if this is something that has really been limiting your life. Anxiety disorders are the most treatable psychological disorders out there. That's good news. I love it when I get clients who are struggling with anxiety because I know, hey, they are very, very likely to get better. And they're usually imaginative, motivated people, so they are eager to get better and they have the capacity to do that. So if you had to pick a psychological disorder to get, this is the one you'd want to pick because it is in fact so treatable. So in our next video, we are going to talk about some techniques to use your brain to help change your brain, and we're going to talk about the anxiety trick. So I hope you will tune in for that.